it's time for Move Well, Live Well with PCI Orthopedics. Today we're joined by Dr. Andrea Stitgen, and we're discussing something a lot of people I think deal with, knee pain, especially knee arthritis. Yes. So can you tell us, what is arthritis in the knee?
So arthritis is really kind of a wear and tear disease.
Okay.
So I like to think of it as kind of a lack of space. So when you start wearing through the cartilage and the bones are rubbing on each other, that's what arthritis is.
Okay.
And it can be really pretty painful. So a lot of people say that they have just arthritis, but really it's not just arthritis. Arthritis is really painful, and there's things that we can do to help.
Okay. What makes arthritis pain different from just like regular knee pain?
So there's lots of different things that can cause knee pain. So you can have meniscus tears or muscle strains or arthritis. And it's hard to tell without really a good physical exam or x-rays in particular. X-rays really let us know how much arthritis you have in the knee.
Okay. So a lot of times I think when people get older, that's when you have arthritis in the knee, but that's not necessarily something you get when you're older. You can have it when you're younger too, right?
Yeah.
Okay.
Especially if you have injuries when you're younger, that can lead to arthritis.
Oh yes, if you're an athlete and
Yes.
repetitive injuries. Okay, well that is good to know.
Yeah.
How is it treated?
So there's lots of different things that we can do. So we usually start with the easier things. You start with kind of over-the-counter medications. So Aleve, ibuprofen, Tylenol, those kinds of things. You can try bracing and working with physical therapy. But then kind of the first thing we usually do in the office is trying injections. So steroid or cortisone injections really help really pretty well.
I bet they do.
So we usually try to go with those as long as we can.
Okay.
When those stop working, then we start thinking more about surgery, and that's usually a knee replacement.
Yes. So you want to talk a little bit about knee replacement. So what exactly is knee replacement? How does it work?
Yeah, so this is what it looks like here.
Okay.
So
this would be your brand new knee.
Yes, exactly.
Okay.
So what we do is we take off just the very ends of the bone here. So just the very ends of the bone, so we can put this cap on it. And then on the tibia, same thing. So take off just the very top of the bone so I can put this cap on it. There's a plastic piece that goes in between, and then often a plastic piece underneath the kneecap.
Okay.
So all the arthritis, all the bone on bone is taken away, and instead it's the metal on the plastic.
Okay.
And in general, people do really, really well after
Yes,
this.
I bet they do. I know a lot of people have both their knees replaced. Do you recommend doing it both at the same time or doing one knee at a time?
So I usually recommend just doing one knee at a time. There is a lot of rehab afterwards, and I think it's hard to rehab one knee really well if you have two knees that you're working on at the same time.
That's true.
I'd rather do one, get one nice and strong, and then start working on the other one.
Well, that's fair, because I think sometimes that kind of leads to other issues too, doesn't it? If you have problems with your knees.
Hurts, then you can be walking differently, and you can hurt your back or your hip and other things too.
So it's definitely something that you want to have taken care of.
Yes, yes.
What's the recovery time?
So after a knee replacement, you're up and walking on it right away. You go home,
wow.
Yeah, you go home either that same day or the following morning.
That's amazing.
Yeah, we're actually doing a lot of these at the surgery center now even, so people go home right away. You're walking with a walker initially, usually for the first week or two, and then a cane for a little while after that.
Okay.
So generally by 6 weeks out, you're walking around really pretty well.
Okay. When can you go back to exercising? Say someone is, running or they're very physically fit.
Yeah.
How long before they can start doing that again?
So it kind of depends on the sports and how they're doing afterwards.
Yeah.
Usually about 3 months or so, people are kind of back to those kinds of activities.
Okay. So that's not too long.
Yeah.
I mean, I know it might feel long at the time, but totally worth it though, correct?
People are really, really happy after they have their knees replaced. Yeah. It gets you back moving, doing the things you want to be doing, just not having all that pain anymore.
Absolutely.
I'd be happy to see anybody, and we can kind of figure out which direction works best for you.
Wonderful.
So.
Thank you so much, Doctor. I appreciate it.
Thank you for having me.
Yeah.